Now we got Dr. Ron Shapiro. Dr. Ron Shapiro is one of the pioneers in hair restoration surgery. Not the old pioneers, but the new pioneers. The pioneer doing follicular units. He teaches most of the doctors that's our field, included me. And he's not just a good friend, but Ron, he is such a person that teaches everybody. Ron, having such a great and vast experience and started doing the FUT, the strip technique, what do you think about the advantage that we see in this Congress about FUE? What do you think the perspective that FUE opens for the hair restoration?
Well, I think that FUE does offer a whole new era in hair transplantation. Initially, I was concerned about FUE because, whenever you have a new technique, it has to bring something to the field. And for me, the most important thing is that you have naturalness and you can get density. And I was concerned about FUE that you couldn't get as many grafts as you could with FUT. However, at this Congress, I've seen, like every new technique, they have to get better and better. And I've seen they've really fine-tuned the technique over the last 5 to 6 years, where they're getting a good number of grafts, 5,000 to 6,000. So I think that you now can start to approach the same type of density that you can get with many patients in FUT. The advantage of FUE is that, one, it opens up being able to get hair from other areas like the beard, like the body. So when you run out of hair, you now have new hair that you can get. Also, an advantage for many people who are afraid of the strip of the linear scar. It makes them more comfortable in trying to start this procedure.
Yes, of course, because the donor area is a supply that we know that ends, and the balding process, we know that is a process that keeps going. So when you see a patient that's around 25 years old, he thinks that he is immediately, I want to get now, but he's not concerned about the future because we are, because we saw that patients coming back 15, 20 years later, so we have to keep doing and keep dealing with the balding. So you think that FUE can stand alone for the restoring process, or do you think that FUT will be still needed in the future?
Well, I think it all depends on the patient. There are some patients who can only have FUE, and there are some patients that I think will need a combination of FUE and FUT. I think that I've never been for the exclusive use of any technique. I think every technique brings something to the field. I believe that because the biggest problem that we have in hair transplant is this limited donor. If we had as much donor, if we had an unlimited supply of donor, we wouldn't even need to have conferences. You could just keep adding hair until you were finished. But the problem is we have a limited amount. And therefore we have to use this limited amount as preciously and as the best way possible. So any procedure that doesn't give you the best amount of hair for that patient is not as good as the other procedure, especially if a patient needs the maximum amount of hairs. And I think that the combination of FUT and then FUE afterwards will give the maximum amount of donor. So I think that it'll always be that some people need a lot of hair. I mean, like 7,000, 8,000. And so those people need both. But there are people that only need 4,000 or 5,000, 6,000 grafts. And for those people, FUE may be enough. There's many people that don't really care about the scar. I mean, you get very good scars with FUT. So I think they're both here to stay. Although, from what I'm seeing in the marketplace, patients love FUE. But, I think they're both great techniques.
Yeah, I totally agree with you. I got patients that come to me, and I like to play with my patient, that hair transplant is like buying a car. You buy a car, and it's the best car ever, and 2-3 years after, you want to get a new car. So the same happened with the patient. They are bald, so they got low expectations, so they want to do a hair restoration, get some hair. But when they are not bald, they want a full coverage. They want to have full hair. They keep going and want it more and more. It never ends.
I agree. That's the way it is with hair transplants. So you need to be able to, the most important thing, and we can't forget this, is the results on the top of the head. And patients want as much hair as they can get, and there's a limit. And we need to use every tool we can to give them the most hair possible. For some people, FUE will be fine. And it's a wonderful technique because there's no scar. I mean, I love doing it. But for some people, I still love the old FUT strip method. I just love it. So, and I love to do both. I'm glad I can do both.
Yeah, I think it's not a debate anymore that FUE or FUT. Both techniques are valid and we should use both, but we should decide how to wisely use both techniques, right?
It should never be the exclusive use of one or the other if they both bring something. And I think that's more of a marketing thing than anything else. But I think they're both good techniques. And I think this meeting has been really good because some of the people that are, in order to get the best out of the field, you have to have pioneers, and there are pioneers in this field that are at this meeting where you have to push the envelope to make the mistakes, to know where the limits are, and then come back. And we have the people at this meeting who are pushing the envelope to see what the most we can do with FUE is. And it's a lot more than I originally thought. And so I think it has a great place, you know, in hair restoration.
Excellent. Yeah, we have to wait a little bit more to see in the future because it's a brand new technique. But yeah, definitely FUE is here to stay. Okay, thank you very much. We've been here with Dr. Ron Shapiro, one of the pioneers and the hairline man. Okay, thank you very much. Thank you.